My name is Sherry Guess, and this is the Heavily Meddled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware, diet, and environments. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll. Hello, metalheads, and welcome to the jungle. Thanks for coming back for this edition of the Heavily Meddled Podcast. I'm Sherry Guess, and today we have an incredibly important topic, an innovation actually that could change the way that we approach ankle surgery and perhaps even other joint replacements, particularly for those of us who are allergic to metal. Ankle injuries and conditions are often debilitating. I have a sister that's had many surgeries on her ankle, and for many patients, metal implants have been really the standard solution. But what if there was a better option and one that could reduce the risk of metal hypersensitivity reactions? Enter the 3D printed Talus implant. One of my followers brought this to my attention. It's a groundbreaking advancement in orthopedic surgery. And to help us understand this new technology, we are joined by an expert in the field. Welcome, Dr. Selene Parekh, to the show. Welcome.
Thanks, Sherry. Great to be with you today.
Let me take just a minute and tell our guests about your extensive and impressive bio, and then I'm going to ask you to chime in with anything that I may have overlooked. Does that sound good?
Absolutely. Thank you.
Okay, awesome. So Dr. Parekh is a board-certified orthopedic surgeon. He specializes in foot and ankle conditions. He's an alumnus of Boston University and earned his bachelor's degree in medical clinical sciences and classical civilization, followed by a Master of Business Administration in healthcare management and a Doctor of Medicine. He had additional educational pursuits, which included a residency in orthopedic surgery, a fellowship in healthcare entrepreneurship, a second fellowship, so impressive, in foot and ankle surgery at the University of Pennsylvania. And this is something interesting that I would like to learn more about. Dr. Parekh retains a certificate in artificial intelligence from the Sloan School of Management at Massachusetts Institute of Technology. Wow. Back to the subject at hand. He's a 3D printing pioneer in total ankle replacements and has designed cutting-edge implant techniques to improve patient outcomes. He's trained future surgeons as a professor at Duke University, is widely published in orthopedic research, and Beyond Medicine co-founded the Parekh Family Foundation, which provides global surgical care and education. He's recognized as a voice in sports medicine through Fantasy Doctors, and we are so blessed that today he is joining the Heavily Metal Podcast to discuss this latest breakthrough. So let's get into the ankle implants. Tell me a little bit more about who you are. Artificial intelligence, what?
Yeah, thank you for that introduction. Clearly, I'm a passionate learner and curious, and so it's encapsulated in all the formal training I've had. About 2.5 years ago, back in early 2023, I moved my practice from North Carolina to New Jersey, North Philadelphia area, in a practice called Rothman Orthopedics, which is where I'm still doing a lot of this innovation and work that has defined my career over the last 20 plus years. AI really grabbed my attention. Actually, now it's part of almost everybody's vocabulary.
Yep.
COVID, right? When everything shut down and for a brief moment in time, even our clinic shut down, I was looking at things that I could do to enhance my understanding of what was going on, not related to COVID, but related to what was coming down the pike in technology. And artificial intelligence was the thing that people were talking about at the time. And I used the opportunity of the slowdown to learn more about AI and healthcare and medicine and ways that we could implement it to make things more efficient in the future. And so we've got a number of projects going on with Princeton University right now, where we're looking at ways that we can make clinical delivery more efficient, more reliable for patients.
Oh, so exciting. So exciting. I can't wait to see how that might play into effect or diagnosis in the metal allergy realm, which is highly underlooked and under evaluated and underdiagnosed, in my opinion, having almost died from it. I don't know if you knew. I'm on my 45th, 46th surgery, but I have severe systemic metal hypersensitivity, which is how we got here. And I don't think doctors are trained in systemic sensitivity. You're trained in localized systemic, but type 4 systemic reactions, almost not a thing.
No, almost not a thing. And to be honest, it's fantastic that the community has a voice like yours to help educate and bring attention to this issue. About a decade ago, I started becoming a believer that these orthopedic implants that were supposed to be inert could actually cause problems to patients.
Oh, yeah.
I had a patient who came in to see me. I hadn't done her primary surgery, but she had a metal implant in her shin bone. And she came in to see me saying, Dr. Parekh, ever since this implant was put into me, I have been feeling miserable. And I've seen rheumatologists, internists,
Yep.
endocrinologists, my orthopedic surgeon, and I want this thing taken out, and nobody's willing to take it out. I said, the reason why it got put in is over. Let's take
Yeah.
it out and see what happens.
Yeah.
I didn't believe that this was an issue, but I said, sir, let's take it out. If it's bothering you, let's take it out and get that off the table.
Yeah.
Literally within 1 week of taking it out, she said, I feel like I'm back to normal.
Yep.
And that was the index patient for me that made me
Yeah.
start thinking, is this a real thing? Because we've never been trained on it, and we've
Yes.
never been told that this is a real thing. In fact, we've been told quite the opposite. And
Right.
that started my path along this becoming a believer.
And God bless you. I can't tell you how many people, and I have foot and ankle people, and I'm sending them your way, Dr. Parekh, that literally go to doctors and they will not take out this foreign body, whether it's symptomatic or not. They just won't take it out, which is
Yep.
unbelievable to me.
In other countries, surgeons routinely take out hardware that's no longer needed.
Yeah.
Yes, it's a second surgery, but in other countries, for religious issues, cultural issues, they need those implants taken out. So they can happen. And again, if those implants aren't needed anymore, they can easily be taken out. It just
Yep.
means another surgery to do it.
Yeah. Crazy. Okay. We'll come back to some of that. But for now, let's go ahead and can you explain the role of the talus bone in the ankle and why it's a critical part of our mobility?
So when you think about it, the ankle, very complicated area, a lot of tendons and ligaments function in this small little surface area to hold your body weight, right? So you have these two little pegs that are holding your whole body weight. The tail is the dead center of the ankle. It is important for the motion, the up and down motion of the ankle, but it's actually more complicated than that. We always think, oh, it's just the ankle, but the talus actually has other joints. One underneath it called a subtalar joint, and the other in front of it called a talonavicular joint. And those two joints move the foot in and out. So the ankle up and down, the next two joints that the talus is involved with move the foot in and out. And so it's a very complicated bone. And in fact, it's one of the only bones in the body that has very few soft tissue attachments. It's almost entirely covered by cartilage. And
Interesting.
because of the soft tissue attachment, the lack of soft tissue attachments, it doesn't have great blood supply. The way bones get blood supply is through soft tissue attachments. It piggybacks on the tendons or the ligaments that are coming in and attaching to the bone. If you have a bone that doesn't have a lot of soft tissue attachments,
Sure.
now it doesn't have great blood supply, which puts it at risk
Okay.
for developing avascular necrosis.
So first of all, thank you for correcting my pronunciation. I guess if I'm going to do a medical podcast, I should pronounce body parts correctly. So talus, thank you for that.
All different ways. So you're good.
I should be
Tomato,
correct.
tomato, right?
There you go. What are some of the most common conditions that lead to talus replacement? Is it more commonly seen in athletes or trauma patients or people with degenerative conditions? How does that shape up?
Yeah, talus replacements evolve because or occur because the talus is dying, right? And it's called avascular necrosis. It's basically
Okay.
the blood supply to that bone is dying. And if the blood supply dies, then the bone, the cells die, and then the cells can no longer support the structure. So the whole thing starts falling apart. That bone starts collapsing. So that's called avascular necrosis.
Okay.
The reasons we develop avascular necrosis, the most common ones are trauma, right? Whether you broke your bone or not. Trauma to the talus can
Okay.
lead to vascular necrosis. The patient who has a total ankle replacement, and
My sister had that.
yeah, so they can develop as a late consequence to a total ankle replacement. They can develop avascular necrosis. Doesn't happen very commonly, but it can happen, especially if you've already on number 2 or number 3 ankle replacement. You can have it for patients who have different comorbidities. So high cholesterol, exposure to steroids, alcoholism, and the list is quite large of different medical conditions that can lead to avascular necrosis. And I would tell you the biggest bucket is we don't know, right? Steroid
Mm,
exposure is a big deal, but
yeah,
the biggest is these patients of mine that I've seen, and they come from all over the world now to be seen. They come in and they don't have those things, and they have idiopathic avascular necrosis. So those are the patients who
crazy.
may be candidates for total talus replacement.
Interesting. So, what were the standard treatment options available prior to a 3D printed implant, and what were the biggest challenges with those implants?
Yeah, so the prior to total talus replacement, one of the things we would do is non-surgical optimization. So anti-inflammatories. Back then, you'd start thinking about, oh, steroids. So you calm down that inflammation, you expose them to steroids, although that can lead to avascular necrosis.
Mm,
Putting them in special braces that try to immobilize the ankle or try to shift weight from the ankle up to the knee. So those are non-surgical treatments.
okay,
Surgical treatments, depending on the stage of the avascular necrosis, could be as simple as trying to drill holes into the bone to try to stimulate healing. But like I said, the blood supply to the talus is not great.
sure.
So you really have to have just a tiny little area that's symptomatic of avascular necrosis to consider that. People tried grafting it with stem cells or cement or calcium phosphate, which is almost, think of it as the joint compound that you use for your drywall, right? Medical grade, obviously, but things like that. We also tried bringing in new blood supply. So working with plastic surgeons to bring in new blood supply to try to encourage healing. And then the last option was what we call a TTC fusion, tibia talus calcaneal fusion, where you try to fuse the ankle and the subtalar joint and lock that ankle and
Mm,
subtalar joint up, which
mhm.
means you lose all your up and down motion and you lose half of the inside outside motion.
Wow.
That was highly debilitating for patients. But in
Sure.
a time when you didn't have options, it's all we
Sure.
had,
Yeah.
which meant patients didn't have motion, which meant that they would walk with a limp, which also meant that pressure and that lack of motion now translated to increased pressure at the knee, the hip, the lower back,
Yeah.
which causes aches and pains up the chain of
Yeah. It's
mechanics.
my half sister, which is why I don't know everything, but she's completely disabled. She fell off a cliff when she was a teenager, and her foot and ankle is this big, and it's bony and it's twisted, and it's just incredibly painful to even look at. And I feel so bad for her. It's just terrible. And I think it's both of her ankles.
No, it can be really debilitating. And then with a TTC fusion, 40 to 60% of the time, one of those two joints will not fuse and they
Ugh,
still have another surgery. And then ultimately, amputation, right? Amputation was always something that could be done. And I
mhm.
would have patients who came in to see me and they would say, this is before 3D printing, say, listen, this bothers me so much, Dr. Parekh, and I don't want a
Cut it
fusion.
off. Yep.
Just cut it off and let
Yep.
me go on and lead the quality of life that I'm looking for.
Okay. So I'm glad we have options. Let's dive into the 3D printed implant. Tell me what makes this technology so revolutionary and compared to the other implants, and talk about maybe the longevity compared to what we used to have available.
Yeah, so the 3D printing world has changed so much in orthopedics and within orthopedics, more so even foot and ankle. If you're thinking about trying to bring motion back to this problem and not have to do a fusion, you almost need that talus to fit like a glove in a hand, right? It's got to fit really snug. And so 3D printing was the way to do that. Now, I would say that talus replacement was being done in Asia, not 3D printed, right? So they're using standard manufacturing, trying to get the best fit that they could. But to get something that fits somewhat well versus something that fits really well can be the difference between success and not success.
So you're saying
And
you can custom make the size to maybe what the patient already has?
so with 3D printing, what we do is it is an exact replica of your anatomy. So we take a CT scan of both sides of your ankle, one that's affected, one that's not affected. If the affected side is not damaged, where it has not collapsed yet, then we can use that side to recreate an exact metal or medical grade plastic replica of the bone. Size, shape, the little divots, the little curvatures, it can be
Wow.
exactly the same. So it's fitting like a hand in a custom made glove. So it's got that exact fit so you can pop out the old bone, pop in the new metal or 3D printed implant, and suddenly you can restore motion and function because that ankle can now glide. So can the joint beneath the ankle, the subtalar joint. And that was the revolution.
So I'm going to jump the gun a little bit here. How do you decide if you are going to use a metal implant or a 3D printed implant? Do you pre-screen all of your patients for metal hypersensitivity or only the ones that have had prior sensitivity? Tell me what that looks like.
All right. So let me walk you through the evolution because when 3D printing first came out, we only had metal. Okay. And
Yes.
it was initially just cobalt chromium was the only metal that we could
Ugh,
3D print.
don't get me started
So we
on
started
cobalt.
off with that and patients were doing well.
Okay.
Then titanium came out. So then we shifted to titanium. And we didn't make a shift because of the metal allergy or reactivity issue. It was just because titanium could be a little bit lighter. And we
Hmm?
thought that it would wear better against cartilage than cobalt chromium. So
Okay.
it made sense to make the shift.
Yes.
Now we are at medical grade plastics. PEKK is the 3D printed medical grade plastic that is now available as of October 2023. And for patients of mine who just need an isolated talus replacement, so they don't need an ankle replacement on top, they don't need anything fused underneath, they just need the talus replaced, we have shifted to the medical grade plastic, the PEK. The reason being, most importantly, it's very lightweight. It mimics the mechanics of bone. And we think that because of that, it can wear against the native cartilage much better.
Okay.
So that's part one of how I decide what patients get. And for me, now, if you need an isolated talus replacement, if that's all you need, you're going to get the medical grade plastic.
Okay.
Okay. Now, yeah, you did ask me about the metal testing, right? So 10 years ago, I became more aware of this. Up until a few years ago, I found that it was very difficult to have dermatologists do orthopedic metal skin testing. It was very hard for patients to find. And
Yes.
then once they found it, it was hard to get it covered by insurance. And
Yes.
so we were just orally screening patients. And the problem is not every patient knows that they have a metal allergy.
You're still orally screening them right now?
So now what we do is we orally will screen every single patient. Anybody who says, yeah, even custom jewelry bothers me, boom, I'm like, that's it. We're getting metal tested. But now in the last few years, you can get the blood test done. So we've had every patient getting the blood test. Now it's a little
And you're
problematic.
referring to the lymphocyte transformation testing.
Yes, exactly. There's only one lab that does it that I'm aware of in the country. They don't take insurance, so
Mhm.
costs can be a little bit prohibitive.
Yes.
But I tell patients that that cost is so much less than the cost of getting an implant that your body hates.
Yes.
And now I've affected the quality of your life forever.
And I think that you might realize, but a lot of surgeons don't realize that we have commercially pure titanium for surgery, but many patients are not that are reactive systemically are not reacting to the commercially pure titanium. They're reacting to trace nickel in the commercially pure titanium that's not even required to be listed by the FDA. And I think for surgeons to understand that's really happening and to the extent it's happening and to the extent it's causing severe systemic symptoms is mind boggling to surgeons. But it's
Well,
happening.
it's happening. And it's funny that you say that because when I first started down this journey, I was told, oh, these are trace amounts. And I'm like, I don't care if it's a trace amount. It's enough that a patient of mine's getting a reaction. So I don't
Yeah.
even want trace amounts anymore. I
Yeah.
want nothing whatsoever because you just don't know where the patient's reactivity is on that
Well,
spectrum.
and unfortunately, you can't help it. Sometimes you've got to have a metal implant, period, and you just have to deal with the side effects, whether they're systemic or not. I mean,
Correct.
unfortunately.
But luckily, I think there are more and more options coming out. And I
Correct.
think industry is now realizing that there are patients who do have sensitivities that may need to be addressed.
Sure. So, how is the longevity of the 3D printed implant? Are there long-term studies that have addressed this at this point?
My practice has the highest volume of these 3D printed patients in the world. And my oldest one out's about 9 years out. So
Okay.
when we think about 3D printing, we're tracking these. The survivorship seems to be very good. The pain relief for 3D printed implants seems to be excellent. The function seems to be excellent, but I don't have 20-year data yet. But we are continually, every few years, going back
Sure.
and trying to publish that in the literature so that the awareness is for the whole medical community.
And at this point, for as far as the 3D printing goes, is it pretty much only the Talus that you can 3D print at this point, or how can we expand from that?
It has exploded. So throughout orthopedics, you can now get 3D printed total knee replacements, 3D printed hip replacements, shoulder replacements, or if you had an orthopedic cancer and you need half of your pelvis rebuilt, that can be
Really?
3D printed. So it is now changing orthopedics dramatically.
All out of the PEKK.
No, so that is a new option only since October of 2023.
Okay.
Its growth is becoming exponential.
Okay.
But in the last decade, 3D printing of metals for patients who need it for complicated issues is occurring throughout orthopedics over the last decade. The
But what about the 3D
PEKK,
printed of non-metals for
yeah,
other
that's only
joints?
been October of 2023, and we're seeing a exponential growth of patients getting that as well.
Wow. Okay. So can you tell me how the material PEKK differs from PEEK? I've
So,
had limited experience with PEEK in a spinal surgery, and I know some of my people ask me about PEEK, but I'm not sure how many of them know about the PEKK.
yeah, PEKK, similar in chemistry. The PEKK, the extra K is because it has an extra ketone.
Okay.
If anybody's taking biochemistry, your listeners. But the bottom line is that little difference changes the mechanics of and the properties of this material entirely. It is obviously hypoallergenic because it's a medical grade plastic, although in theory, somebody could be allergic to that plastic. It has antibacterial properties more so than PEK itself. So
Okay.
PEK versus PEKK.
Uh-huh.
It allows bone to integrate much better. For whatever reason, the bone forming cells seem to really love this PEK material.
Okay.
And those have been the biggest things that we have seen. And one of the reasons why orthopedics is really starting to shift some of the surgeries to patients to that material because it has some really unique properties.
And now, a word from our sponsor. Attention metalheads. Are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses. Get to the root of the problem with ELISA testing. ELISA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit melisa.org to learn more and schedule your test. Trust us, you'll be glad you did. MELISA, a valuable diagnostic tool in medicine.
Okay. Is it being well received among your peers? And do they have criticisms about the implants? And if so, what are they? And how do you
I think
overcome
you're
that?
seeing early adopters using it. What I normally see, just like any early adoption, is you'll use it for the really tough cases or ones that you
Yeah.
don't have any other options. Once those do well, you start expanding your indications. They keep doing well, it keeps expanding. And I think we're still in that early phase of careful deployment of that technology in tough cases and seeing how it performs. And from what I understand in my own experience, it's performing fantastic.
Fantastic. So for many patients with metal hypersensitivity, foreign body reactions are still a concern. Did the 3D printed implants lessen the risk of foreign body reactions, or is the jury still out?
I think for the non-metal ones, so far we have not seen that happen. But again, theoretically, this is a foreign body. So
Sure.
just because it's not metal doesn't mean you can't have a reaction to it. We're just not seeing it yet. And theoretically, hopefully it'll be less. But it's tremendous. I had a patient who had a metal ankle replacement that I had put in. We
Hmm.
screened him orally. He said, he's never had an issue.
Yeah.
He does well for about 3 months. And then after 3 months, he starts having a lot of pain. And we do the whole $1 million workup for infection to try to
Yeah.
understand, to make sure he's not infected, because that's the number one thing we worry about.
Yeah.
Wasn't infected. So I asked him, any chance you have a metal allergy, even though he said he didn't? He said, no, not that I know of. We get him tested. He pings for aluminum.
Okay.
Aluminum. And aluminum is a trace material in many of these implants.
Sure.
So he got the world's first ankle replacement made out of PEK. For any of your listeners who are interested, if you Google my name and CBS News, you'll see the news report that CBS did on it, and you'll hear in his own words how this transformed his life.
So
The
is this
3D implant.
not only a talus replacement, but beyond that, a full ankle replacement?
So he did not need a talus replacement. He just needed an ankle replacement. So what was traditionally two metal pieces and a plastic piece between, he got two pec pieces and a polyethylene piece in between.
So it really does go beyond the talus. You can do a full ankle fusion that is non-metal.
Full ankle replacement that is non-metal. Correct.
Full ankle
We
replacement.
can now do that.
Wow. What about a revision from a full metal or from a full ankle replacement that was metal that perhaps somebody is allergic to? Can you revise
So that was
that?
my patient. Yeah, that was my patient, and we revised it.
Okay.
So we pulled out the metal, put in all the PEC with the polyethylene, and no reaction.
Sorry, my brain is just spinning. Wow,
It is an amazing time to be in orthopedics because from a material science perspective, AI perspective, 3D perspective, there is so much happening that is transformative and different than the way we've done things before. It's an exciting place to be from a provider perspective.
That's just crazy. Do you think that orthopedic surgery is moving in the right direction in terms of implant materials like this? Are we seeing a shift toward more biocompatible and personalized solutions?
Both, right? Biocompatible and personalized solutions. 3D printing gives you that more personalized, but biocompatible, there are companies coming out with materials that are biointegrative. So you can get screws now that are not made out of metal, but they are made out of a fiber.
It'd be like osteofiber?
Yeah, exactly. So it's exactly osteofiber that basically will become bone over 2 years. So I've had patients who need bunion surgery and they know that they have a nickel allergy or a titanium allergy, and they'll ask me, can you do the surgery without metal? And yeah, we can.
That is so fantastic. Is there a part of foot and ankle surgery where you absolutely can't yet do this certain surgery without metal? And what would that be?
Yeah, I think so. We don't yet have plates that are not metal, although I'll say that there's some carbon fiber plates that are out there, but the screws are still metal.
Yeah.
So we yet don't have a system of plates and screws that are all non-metal. That's coming. That is coming because we already have screws. We already have PEC plates. We have carbon fiber plates. At some point, somebody's going to develop the technology to bring in plates that go to screws with a system that we can then use off the shelf for patients.
Is that something that AI would be able to help speed along?
The AI is really cool because it can help speed along the 3D printing design work, right? In the past, you'd have to get a CT scan. The CT scan then has to be put back together to kind of give you a three-dimensional reconstruction. And then an engineer would have to sit there and map it all out and figure out how to make the implant. Now you can have AI do that whole thing, and you just have an engineer at the end certify that everything that was done by the AI modeling is correct. So the time from planning to implantation now is dramatically shortened because AI can do all of it.
So awesome.
Yeah, it's very cool.
So what do you think needs to change to better support patients with metal allergies with orthopedic care?
Two things. Patient awareness. Unfortunately, the patients who are known to have metal allergies, reactors, they already know that this exists. But there are a lot of people, I think, out there who live in chronic pain, who have had orthopedic surgery. And I don't know the numbers, but I think that there's probably a substantial number of them who probably have a metal hypersensitivity that they're unaware of. Right?
Here's where I'm screaming. So you've got 20% of the population that's allergic to nickel. We're just talking nickel. We're not talking aluminum, titanium, cobalt, chrome, any of that. So 20% allergic to nickel. Of that, 3 to 5% are systemically allergic. That's in the published literature, and it's likely double that due to under-identification and reporting. So just in the US alone, I think I did some fuzzy math, but it was over 2 million people. And I can just tell you in my personal realm, and I think once surgeons and once the media and once patients realize what's really going on here, going back to cardiac and vascular stents, surgical clips and staples, 3 clips used during a gallbladder surgery, and somebody walks out 6 months later and develops fibromyalgia, and nobody is connecting the dots. I think that we are sitting on a humanitarian crisis of epic proportions. Medicine is great and doctors are fantastic, but this is not on anybody's radar. The precious few like you.
So that was going to be my second challenge here, which is increasing awareness,
Yeah.
but acceptance that this is a real thing. And I'll give you an anecdote. I was at a meeting about a year and a half ago, and all orthopedic foot and ankle surgeons from around the country and on the world were at this meeting. And somebody was presenting a difficult case. And this patient had gone through 4 or 5 different surgeries, and they were being presented as to, now what should I offer this patient? And a lot of people were weighing in on different things. And I got up and I said, have you ever metal tested them? And the moment I said that, everybody started laughing at me.
Oh.
And I said, I don't know what you guys are laughing about. This is a real thing. And the panelists, who are all friends of mine and colleagues of mine, said, yeah, sure. Yeah, we'll get them metal tested, as if I was a joke. Whether they did or didn't, I don't know. But that response of blowing things off, I think, has to change, right? I think the awareness and the acceptance that this could be a reason why a patient who has a perfect looking x-ray is still miserable. You have to get that answered. Are they hypersensitive or not? Because I think a lot of them will be, and you got to get them tested and get that issue off the table, or it's a real issue.
And this is mind-blowing to me that this happens even in a professional setting, because it's bad enough when you're the patient and, you've got your doctor and surgeon up on a pedestal and you go in and you're gaslit and blown off and the patient is laughed at. That's pretty humiliating and hard. But I can't imagine somebody with your expertise and your knowledge, been multiple degrees and been through medical school, and this is not your first rodeo, and being laughed at by your peers. I think that is unconscionable. It's just crazy.
Well, but you know what? I think whenever you disrupt the standard thought process and ideology, you initially get laughed at. And I get it. But over time, as people realize that this may be real, you get validated. And so that's okay. But it's funny because we published about 3 years ago my series of early patients who had revision surgeries where we recognized that they had a metal allergy and then did something different without those metals. And we published it. And I posted it on social media. And
I'd love to see all of that.
Outside of so in the orthopedic world, but outside of the foot and ankle world, people had commented who are well-known total joint replacement surgeons around the country saying, why are you posting this kind of stuff? This is not real.
Yeah. Yeah. And it's
Right?
amazing. I could just speak to my experience. So I've had many numbers of surgeries, but my first experience when we first figured out I was allergic to metal, and I had, thank goodness, my spine surgeon who believed me, went and took out 10 of 13 pieces of spinal fusion hardware at L5S1. And when I woke up in the OR, 60% of the pain in my legs was gone. And we see this from the minute patients wake up in the OR, many times the pain is completely resolved. In your patient, it took a week. I'm seeing many patients that it doesn't take a week. They wake up. And I've had repeated surgeries. When I had my Tarlov cyst surgery, and they took 4 little titanium microplates and screws out of my sacrum, literally woke up and all the symptoms I had that came on 4 months after they put that in were gone.
Yeah.
It's amazing how fast it just unpacks itself.
When you start paying attention to it, it is fairly prevalent.
Yep. Crazy. Where do you see 3D planning heading in the next 5 to 10 years in orthopedic surgery? We've talked a little bit about it, but can you get more specific? And then could we eventually see fully personalized implants?
So I think there is a future in the next 10 years where you get fully personalized implants for most of your orthopedic surgery. I do think that in the next 10 to 15 years, 3D printing will be so refined that we're no longer printing materials in terms of metal or plastics, medical grade plastics, but where there's a future where we're 3D printing cells and cartilage and biomaterials that are native to the human body, so that you're going to get a joint replacement that's a restoration of cartilage and bone.
That just sounds like sci-fi.
Yeah, it does sound like sci-fi. So does the iPhone was sci-fi for a long time, and
Sure.
And 3D printing was, and AI, and it's all here and now. And I think that's going to happen. Hope that it happens during the time when I'm still practicing, so that I can actually be part of the change. But I think it's happening.
Oh, that's so incredible. Okay, so let's talk about surgical recovery and considerations for that. Patients that are considering an implant like this, what does the surgical procedure involve, and is it more or less complex than the traditional ankle replacement?
So when we talk about talus replacement and an isolated talus replacement, it's fairly quick, very similar to an ankle replacement. They're in a cast, not walking on it for 3 weeks. And it's really, the reason we do that is we want the incisions to heal without a problem. We want that soft tissue envelope to heal without a problem. After that 3-week period, we're letting them walk on it in a boot. And at week 6, they're back in their shoes working with therapy on motion and strength. So that's for your pure isolated bone replacement for a 3D printed metal or non-metal implant. When you start talking about bone integrating into these implants, either integrating into metal or integrating into PEC, we tend to be a little bit more cautious because you need the bone to have time to integrate into that material. So anywhere, depending on the complexity of the surgery, they're going to be non-weight bearing for 6 to 10 weeks at that point. And then a month in a boot and then back in their shoes.
Okay. Who might not be a candidate for surgery with a 3D implant, and what are the contraindications?
It's so varied depending on the issue, but at a very high level, I would tell you patients who have something called Charcot neuropathy or Charcot joints, we tend to see that in patients who have neuropathy around different joints where the bones start crumbling, and primarily because the nerves are no longer nourishing the skin, the soft tissues in the bone. That's usually associated with some vascular changes as well. Back before the day of antibiotics, that was an issue we saw more with syphilis patients. Obviously, with an era of antibiotics, now we see more with diabetics who are uncontrolled. Those patients probably are not good candidates for these motion-sparing implants because they don't know where their ankle or foot is in space because they have neuropathy. And because they don't know where their foot is in space at a refined level, not at they can look down and see where their foot is.
Sure.
But that puts that joint susceptible to being at an early failure because you don't know how you're landing your foot on different surfaces.
Okay.
Right? I think that's the biggest contraindication. In the era of infections, as long as we can clear the infection, I would put a PEC implant in a patient where it's got antimicrobial properties inherently in the material.
How does it inherently have antimicrobial properties? That's really curious to me.
Yeah, the surface charges of that plastic are such that it doesn't allow a biofilm to form around it, so bacteria cannot latch on it.
Interesting. Okay. So can you tell me how the recovery process compares between somebody with a metal version and somebody with a non-metal version?
It's the same. It's very similar, no different. All you're doing is exchanging out material, synthetic material, metal versus a plastic to accomplish whatever your final result or function.
And I'm just thinking in my head, so if it's non-metallic, it would make sense to at least a layperson that you would have less corrosion and less implant debris, perhaps?
The jury will be out on that. In fusions, right? If you're trying to get a fusion, there's really no metal debris because the body's just growing into it and locking it all up.
Okay.
In motion, right? And any type of motion like a joint replacement, you can generate metal debris as the implant goes back and forth.
Sure.
We already know that you can develop plastic debris because every single implant has polyethylene.
Okay.
And as the metal rubs against the polyethylene, you can get debris. So the same thing's going to happen with PEC. You'll get some debris. The question really becomes, is that debris going to be reactive for the patient or not? That we don't know yet.
What is the allergy or toxicity profile for polyethylene? Is that going off track too much?
I don't think it's going off track. I tried looking it up on available resources through PubMed or even online through Google.
Yeah.
I really can't find anything on it. Now, I don't know if that's because it hasn't been implanted enough that somebody's looking at that or nobody's looked at it at all yet.
I was going to say, surely somebody can't be allergic to everything, but then we know there are those people.
Yeah, it exists. Right? These things are foreign bodies. So I tell patients, it's not that it's not reactive at all.
Benefit versus risk. If your quality of life is going to be so much better with this implant, is the reactivity going to be more than zero? Probably. But if the benefit outweighs the risk.
Zero, but under the threshold for you, then you're fine. And for most people, it's under that threshold.
Correct. So tell me how insurance is handling the new 3D implant. Are they reimbursing or is it taking appeals?
We are using standard surgical codes that the insurance recognizes so that those surgical codes are the same.
Okay.
And reality is the insurance doesn't care then if you're getting a metal, a 3D printed, and off the shelf. They just care about the codes. So those are getting reimbursed. Now, the cost to do the surgeries can be more, and that's something between the health systems or the hospitals and the manufacturers to try to
Okay.
figure that out.
Okay, awesome. I think we've covered a little bit, but I'm going to ask this a different way. Are there any unique risks associated with the new technology that patients should be aware of?
I think patients should be aware that it is a new technology. So any surgeon you see who's using it, including myself, we don't know 100% how it's going to behave and how 100% is going to be successful. We will be tracking this over time,
Sure.
but I can't tell you that we've got all this data of knowledge to share and say, hey, this is how it's going to be. We just don't know. Time will tell. I think
And
that's
what
the
kind,
biggest thing.
and what kind of feedback have you received from multiple patients who've undergone the procedure? You told me about your one patient that did the news story. Do you have any other favorite patient stories related to this implant?
I think it's the one who connected you and I, a patient who required a Talus replacement, had a metal allergy, so she did not get it done. And then eventually, when the PEC was available, got it done. And after, I think, 5 or 7 years, she's back to work and putting weight on that limb. And it's restored quality of life in a way that she'd not have had if she had a metal implant.
Super, super grateful that she connected us. And how did she find you?
Back at the time, I was at Duke in North Carolina, which is where she originally lived, and then followed with me as I moved to New Jersey. And when the PEC became available, decided to have her care with us.
Awesome. Dr. Parekh, this has been such a fascinating conversation. Before we wrap up, tell me what your key takeaways are that you'd like our listeners to remember about 3D printed Talus implants and their advantages over traditional metal.
I think that for 3D printing implants, patients need to, if they're deciding to look down this path, make sure they are talking to a surgeon who's got a sizable amount of experience with it. Because just like any surgery, if you don't go to somebody who does it a lot, you may not get the outcomes that you want, number one. Number two, if you can't find somebody, you may need to just reach out to the companies that make them, and they usually can direct you to somebody in your area. I think patients also need to realize that not everybody needs a 3D printing implant, but 3D printing suddenly allows you to have so many more options that you probably didn't know you had. So it is worth exploring that. And then the material sciences are changing constantly. So if you do have a metal allergy, make sure you communicate that to your surgeons, whether they're orthopedic or not. If you're going to get exposed to any metal that's going to get implanted in you, make sure you're communicating that with your surgeons.
Okay. So finally, where can listeners learn more about your work and more about this technology? And then are you willing to see patients from out of state, out of the country?
Yeah, that one's easy. We see patients from out of state, out of the country all the time. If you Google my name, you'll find me all over the place. So you can follow me on social media. I'm on all different platforms. You can follow the YouTube channel. We just wrapped up a 24-hour foot and ankle meeting that we run once a year. That's open to patients and providers around the world. It's the only one of its kind. And every year we take different topics. So you'll find a lot of cool content on our YouTube channel. Again, it's under my own name.
Wonderful.
And then
We'll
my
put all
website.
of this in the show notes so everybody's got that.
And my website as well. So I'm easily findable. You just got to look at my name.
And you're so approachable. And I'm so grateful that you're willing to talk to us and bring this out to the patient, because so many of these things happen behind closed doors in these surgeon meetings and physician meetings, and we don't get to hear about this. So I really am grateful. Are you connected with Dr. Scott Schroeder at all?
I'm not.
Okay. Are you familiar with his work?
No.
Okay, I'm going to hook you guys up. Stats. Let me tell you, we've done a lot of work with Dr. Schroeder on the podcast. He's one of the reasons the podcast even started. He's a retired foot and ankle surgeon, 30 years, and he is famous for lecturing surgeons worldwide on metal hypersensitivity. And he is pretty much a metal allergy guru. Since you're both foot and ankle surgeons, that would be a really wonderful connection. And he's done a lot of work with fascinating work with galvanic reactions, like literally in vivo studies in the OR between like dental hardware and foot and ankle hardware, and literally proves that when you remove like a foot and ankle plate in a patient, the electric current in the body drops by 200 millivolts. And yeah, he's done
I would enjoy the connection and then even a conversation with him, though.
Oh, yeah, you guys are going to hit it off. I'm going to be hearing about it forever. So I will hook you up imminently.
That'd be great.
Again, Dr. Parekh, thank you so much for joining us today and sharing your expertise. This conversation has been super eye-opening. I know our listeners are going to appreciate learning more about these advancements. And to our listeners, thank you for tuning in to another episode of Heavily Meddled. Important links for today's episode, as I just mentioned, are in the show notes. We have tons of links and helpful information on the resource page at heavilymeddled.com, a link to sign and share the petition that urges medical providers and facilities and their establishments to screen patients routinely for metal hypersensitivity. If you found this discussion helpful, please share it with others who might benefit. Be sure to like, share, and subscribe on all of our pages for more episodes on metal hypersensitivity and groundbreaking medical innovations. The metal allergic patient has suffered for too long. We need so many more options. Thank you for helping us to lift our voices. Usually I would sign off with, we're not going to take it anymore, but this has been such a positive and enlightening episode. I think today it's more important. I'm wearing my Journey shirt to say, don't stop believing.
I'm with you. Thanks, Sherry.
Thank you.
Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavilymeddled.com, where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.